further ado, we'll move right along. Thanks for taking the time to do the survey. Every month we feature a different recovery community center so that we can hopefully get some more insights about kind of how these things work, how they look. And today we're blessed to have Dr. Mark Lassiter, who's a board member of Will's Place. So I'll hand it over to you, Mark.
Mark, you're currently muted.
Thank you, Dr. John. I'm Mark Lassiter from North Carolina. I'm a dentist actually in recovery for 19 years, and I've been on the board of Will's Place for about 4 years. We wanted to say, first of all, we're very excited to be a part of this. We are excited to know we're not living in a vacuum here in North Carolina, in rural North Carolina, doing what we do, and that there's so many minds coming together to help us come up with, evidence-based treatment options for our patients, so that what we do is working, and we know it's working. We're excited to be part of your endeavor. Thank you again. Would like to start this with a video, if you don't mind, to sort of give an overview of Will's Place, and then I'll go from there.
Every 4 minutes.
Let me know if you can hear this, by the way. I know sometimes Zoom.
I can.
You can? Okay, cool.
Yeah.
Great.
In America dies from an overdose or alcohol-related cause. At Will's Place, our mission is to provide people struggling with substance use disorder, those in or seeking recovery, along with their families, the tools, resources, and hope they need to create a different and healthy future. A North Carolina 501c3 nonprofit organization serving the community of Stanley County, Will's Place is the only free resource center in the county focused on holistic care, helping connect you with a detox or rehab center for initial treatment, and then providing follow-up care, such as programming and events centered around recovery, supportive, non-judgmental relationships, peer support, wellness programs, and tools like LifeTrack, smart technology that provides targeted and personalized treatment with data-backed precision to help sustain sobriety. Reach out to us in person, by phone or email, or find us on social media. We're here to help you on the journey to recovery.
Thank you. So yeah, as you can see, we are basically going down a progressive track to using data to support what we're doing. We started out as several years ago in 2017, and were formed based off the death of Will Hudson, who is the founder, Allison's brother, who died of a fentanyl overdose 10 years ago this year. And out of that tragedy grew Will's Place and the concept that we needed to reach out to our community and help. And basically it started with no money in a very small building, and it was a resource center, basically connecting people to whatever resources we had available at the time, which was in large part detox and hopefully some sort of primary treatment. We've grown since then quite significantly to the point where we've created relationships with the local hospitals and the politicians, schools. We're very program driven. Our three-pronged approach is to combat stigma, to provide a long-term sobriety, staying in sobriety for long-term successfully, and to basically give access to our people and take down barriers to that care. The biggest barriers, obviously, I mean, from what I can tell, are financial and just people being willing to say they need help. So we have several programs that start as early as basically elementary school level, so we can reach out to elementary school students to have a summer camp, and they basically apply, and if they're affected by addiction or even in the families in recovery, we can start them very young, kind of getting them an insight on what addiction is. We also have a high school program. We have a faith-based leader. We have a twice a month faith-based membership meeting that we have for our participants, and we basically look at the patient as a mind, body, spirit. So we actually have programs that come in from the hospital, teach about diet. We're looking at mental health concerns. So we're trying to cover all the bases, and a lot of it, I will have to say, is efficacious, but we still don't want to be spitballing this forever. We want data. We want to interact with you guys, and the best minds in the world. We would have never had this option a few years ago, and it's extremely exciting to us. One of the things we're using now is a ground floor technology where we use Aura rings to track certain things like heart rate variability, where we can maybe get some insight on what's happening to people before they relapse, and have interactive kind of ways of keeping them encouraged to stay in recovery. So in terms of data to know what's working and what's not, we don't have a lot of that yet. We're getting ready to start data collections and dashboards to report to our board and to our stakeholders. So we're excited about that as well. Recently, our political support has included a $1.5 million grant from the state of North Carolina Capital and Infrastructure, basically to allow us to build a huge center, something that we can take and create our own ability to have individual centers for people to go in and do telerecovery. We have places where we can do presentations, audiovisual centers, offices for other auxiliary staff and people in the mental health field to come in and help out, training rooms, things like that. So it's amazing that we went from this small center, thanks to the Hudson family and the community, to this. And I will say a lot of us have been affected or are in recovery. And I really think that's important. I was thinking about how I could use my 4 minutes today. And I sort of broke down in tears because my father died of addiction. I have 5 children, 2 of them, one has been in recovery, one needs probably to be in recovery. I know how this affects families over generations. And to have you guys sit here and listen to us in our little recovery community center in Stanley County, North Carolina, and be able to take what you're doing now and explode it into the world and maybe have some really fast impact, visceral impact on people is so exciting to us. And we really thank you for letting us share, let us share our vision and what we're doing. And really our vision is, I think, the same as yours, which is to create a culture in our community in Stanley County, North Carolina, to allow people to feel comfortable coming into recovery, and then also to be guaranteed that what we lead them into is going to work and be sustainable. And I think that's where the science comes in, and that's a good thing. So I thought about it like it's your compassion and love, and it's meeting science and the ability to have predictable evidence-based care. And that's great. So that's it in a nutshell. We're growing, we're down here. I don't know what's going to happen. I'm sitting here talking to all you guys. We never thought this would happen. We'd have this opportunity. So it's just exciting, and we're all grateful for you having us involved in this, and we will do our part, I promise. Thank you so much. And if anyone wants to come visit us and share information, feel free to get in touch with me, lassiter.mark@gmail.com. Thank you.
Mark, that was totally awesome. Getting a lot of love in the chat. Thank you for that. It was just beautifully done and concisely done. Passion, compassion, science, those active ingredients that you said, it's so powerful, isn't it? That combination. Let's hope we can, move it forward. And thanks for your collaboration and support of what we're doing as well. We want to support you, and we're grateful for your support. So moving right along to our